Welcome back to Bloom. Having a beautiful and youthful appearance is important to most of us. We all want to look our best. As we age, our skin loses collagen, which can cause drooping and sagging, especially in our cheeks. Joining us to talk about some easy ways to give your cheeks a lift is Dr. Hermann of Hermann Wellness. Welcome, Dr. Hermann.
Thank you.
I think this is something people can't escape as they age, and you've been helping patients for 2 decades. So do you have a lot of patients that come back and back getting you to adjust their cheeks?
Yes.
What's that time period normally like?
So we have filler that ranges from 1 year to 2 years.
Okay.
And there is an 18-month filler.
Okay.
So it really depends on, whether the person, for instance, I just saw someone today who, had never had cheeks before. So I encouraged her to use the 1 year filler, Juvederm. And then if she likes it, she can always come back.
And that's why patients really come back to you, because you're very honest with them. You don't always push, what's the most expensive or the most treatments. You push what's right for them.
Yes. And a lot of times when we do cheeks, it may require a couple syringes of filler. But if somebody's, not sure, and we've all seen people who've been overdone on TV or, maybe in real life. And so,
but not at your clinic.
Not at my clinic. And so we might do 1 syringe, have them come back in a couple weeks and, decide if they want a second. So, so we take it in stages.
Great. And so our cheeks, they begin to sag. So what is the solution?
So, there's many things. There's laser, there's PDO threads, which we talked about last week. But we have filler. If we really have volume loss, the first thing we need to do is replace that volume. And we're not talking about giving us cheeks we never had.
Okay.
We could, but a lot of times it's just as we get older, we start to lose the volume in our cheeks, as well as volume in other places. And so just turning it back to the same level of volume that you may have had 10 or 15 or 20 years ago will look very natural. And will help lift sort of the side of the face. Will sometimes help with the jowling that can happen as well, because a lot of that occurs due to loss of volume, before, where there might have been more structure in the cheek.
So how is a filler, you mentioned Juvederm, how is that administered? So
typically it's with very small needles. We numb the area prior. And it takes, honestly, a matter of minutes.
It's a quick procedure.
It's a quick procedure. Typically, we say don't wear makeup for an hour or so after, but other than that, you go right back to work and going about your business.
So you're seeing the results pretty quickly as well?
Immediately, instantly.
People, and patients like that, too.
Oh, they love that. They love that.
Now, is this something that only women would get, or it's men and women?
Both, for sure.
For different reasons?
Similar reasons.
Just different
we both lose
structure,
volume. Right. But exactly. So the aesthetic we might be trying to achieve for a woman might be a little different for a man. With women, we kind of want that heart-shaped face. So if we've lost our cheekbone, if we add back the volume, it gives us back that heart shape or a V.
And here's one right here.
Yeah. So you can see she sort of looks just a little more contoured, angled at her profile there. And then, a man, a lot of times they're not looking for a high cheekbone, but they still, if they have volume loss, they're going to be hollow a little lower.
Okay.
And when we fill that in, will also help, because that contributes to jowling on men and women, that loss of volume. So just makes them look more youthful as well.
Now I hate to ask this, but is this something that you've had done?
Yes.
And do you like it?
I love it.
Okay.
Yes.
Does it just, and you talk about giving people confidence, but does it do the same for you?
Yeah. I mean, I'm 46, so
wow.
I have to do what I can do to just maintain. I've always had large cheeks. I actually don't do that much filler in my cheeks. But, if I start seeing an indent or a hollow, I'm just going to try to make it look smooth.
Well, I love that you practice what you preach, and you get that benefit as well. If you would like those benefits, for more information, you can go online and visit drhermann.com.